Hello, welcome to my video about Pilates for low back pain. It's 6 months on, we're still not having our normal classes, our normal Pilates classes, and so we're still online doing stuff. If you don't normally come to my classes, take care, make sure you've got room around you, you're not going to knock into any furniture or walls or squash any animals or anything like that. But just a little thought about lower back problems and pain. Mostly it's most back problems are just general stiffness. If you're doing something in the garden or you're doing some DIY and you've done a lot of movements with your arms or your legs or something, and your arms or your legs are stiff, then you don't really think anything of it. But because it's your back, you start to worry and you think, oh my goodness, what have I done? And it's probably no more than just normal muscle stiffness. And stretching out will very often help that enormously. You could get a little bit worse sort of back pain. You might feel, you bend over and you feel something kind of go in your lower back. And you might find that, very painful of course, you might find that you lose the natural curve. Now you have a curve in your back here, and sometimes when you have back problems, you kind of lose that curve and it goes flat like that. And your knees bend and you end up walking around in some strange manner. And it's very painful. And again, these couple of stretches might just help with that. And of course, then you might have something more significant wrong with your back. And if things don't improve in, say, a week or so, then obviously the best bet is to go to your physiotherapist or your doctor or osteopath. You might need something a bit more in depth to sort that out. But a couple of things that you can certainly try. I do it if I wake up and my back is stiff in the morning, if I've done lots of gardening, there's a couple of exercises I do. We'll just go through those just to show you. We'll do the shoulder bridge first. Now, even if you usually use a block when you lie down, I imagine that you already do Pilates or yoga. Now, for this exercise, don't use this because it puts a bit too much pressure on your neck. So flat on the floor and shoulders down. Now you've got a little curve under your back, your natural curve there. And then for your shoulder bridge, do a little pelvic tilt so you lose your natural curve, press the small of your back into the mat, and then peel your spine away from the mat, a bone at a time, till you end up in a straight line from your knees down to your shoulders. You breathe in as you hold that, and you breathe out as you curl down through the spine. Now you're trying to separate the bones on the way up. You breathe in again, your little natural curve, press the small of your back into the mat. Now peel up, pretend your spine is like a string of pearls, and you're peeling up a pearl at a time. Breathe in as you hold, and then peel back down again, a bone at a time. So this is just stretching your back out. You're also strengthening your gluteals as well, which is a bit of a bonus. It might be, if your back is painful, that you can only do a few of them, but just do what you can. Now the rule with Pilates is that if a movement hurts, you don't do it, but I'm guessing that if you've got low back pain, it already does hurt. So just go very gently. Don't want to make anything worse, but this is a mobility exercise and it should help. You could do this, say up to 10 times. Aim for 10 repeats of this one. So we just finish that one off for now. And then always be very careful, just keep your knees bent, roll onto your side, and we'll just roll onto your front. Legs slightly apart, hands under your shoulders. Now, I do this in the morning if my back is stiff. I've done something the day before and I am stiff. And it might only be that you can only come up a little way. That's fine. Come up to where you can. And you might find that the first one of these, you can only move a little bit. And gradually, by the time you get to number 10, you're moving fine. Try and breathe in as you come up. And breathe out as we come back down again. Again, we're aiming for about 10 of them. If you need to, you can keep your elbows down on the mat and just come up a little way. Aim to keep your shoulders down. It's very easy as you come up for those shoulders to come up. So really work on keeping the shoulders down. Now for posture, if you haven't normally come to my classes, my video number 1 goes through posture. So that could be helpful with that. So aim for about 10 of those. And actually those 2 you could do 2 or 3 times a day really. It would be all right because they're stretching sort of things. There's a couple of stretches you could try as well. You could even try one sitting down, just stretch your glutes out. Now it's important you lift up tall and just come forward. Do that sitting. You can try the other side as well. You might find that helps. Stretching up. If it makes it feel worse, then don't do it. And that's actually stretching out more this area. So try that. Hopefully, well, it should. It should start to ease off fairly soon if it's just stiffness. It's important to keep moving. The worst thing you can do is to lock up and not move at all, or just sit on the settee, because it's a terrible position for your back, really. Standing is better, lying flat is better, but I'm afraid sitting down, because you're in this bent over position, making it worse. So just be careful with that. When you're pain-free, you could perhaps think of strengthening more. So think of strengthening your core, and there's lots of exercises. Pilates is very, very good for strengthening your core. One very good one, but I stress, don't do it when your back is hurting. Wait until your back feels better and then start on trying to strengthen. This one is a good one. It's a plank. I'm sure you've heard about. Let's move that out of the way. You're on your front. Get down beautifully onto the mat. One knee and then the other knee. Try not to just flop down. And of course, getting down to the mat or the floor might be really difficult for you. So, just take it easy. Get some help if you need to get back up again. So anyway, you're pain-free when you're doing this one. You've got your elbows under your shoulders and your palms flat and your shoulders down. Lengthen the legs away, navel in and up and diagonally back to the backbone. Breathe in to prepare. Breathe out and you just lift your hips clear of the mat. So really lengthening the spine, and then you hold this position for up to 10 breaths. So this is a good strengthening movement. If you're wobbling and shaking, well, it just shows that you're working hard. At any time, if you want to stretch out, you can sit back on your heels and have a stretch. So do that at any time. We won't go through the whole thing because these are things you can do for yourself. If you're able to, you could then work on coming up onto your elbows. Breathe in to prepare, breathe out, and we lift and we hold that for up to 10 breaths. Hold it for 1 breath, come back down if you need to. Sit back and stretch out at any time that you want to as well. This is really strengthening. If you really want to get strong, build up, and you could even build up to sort of 3 minutes with that one. Don't go any more than 3 minutes. There's no point really. Just keep working at it. Don't do this one every day. Perhaps a couple of times a week maybe, or every other day, but leave at least a day for recovering after doing it. There's another one as well which you could try, which is 4-point kneeling. Breathe in to prepare, breathe out, you just lift the knees clear of the mat and hold that one for up to 10 breaths or a minute if you want to time it. So they're strengthening ones, but I stress don't do them when you're hurting. And then think about moving on, increasing your core strength. Be careful of your posture. Think of your sleeping position and getting up out of bed. You know, bend your knees, roll over onto your side, push yourself up. If you're lifting anything, if it's too heavy for you, have a little try first. If it's too heavy, get help. Don't try and do it on your own. Sometimes you can hurt your back because you think something's going to be heavy and it's dead light, and then so be careful of that. Think of bending your knees when you bend down to pick something up, or when you bend down, keep your back flat as you go down. That's another way. Keep this nice and flat here. Don't roll over that way. Just flatten. Or you could, if you're picking something up, you can use sort of a counterbalance of your leg, and you can just bend down and pick it up that way. So all things that work well. The basic thing, keep moving, really keep moving. I know people don't want to take pills, but if you need to, take a couple of paracetamol. If it keeps you moving, it'll do its job, and try your stretches, and hopefully it'll recover pretty quick. So I hope that helps, and see you again soon.